Hello and thank you for joining us. It's slightly past 2 p.m. here in Seoul. We're moments away from taking you straight to a briefing from the South Korean health authorities on the COVID-19 situation. I'm Daniel Che here to bring you the latest. Very soon we'll cut into the briefing with simultaneous interpretation in English. Today, Chung Eun-kyung, Commissioner of Korea Disease Control and Prevention Agency, is expected to provide details on the coronavirus situation here in South Korea, and that includes the number of new infection cases seen as of midnight, also what kind of efforts the government is making to contain the virus and prevent increase in cluster infection cases. Now, with the Chuseok holidays ongoing, we're in the midpoint now. Various measures are in place to stop a surge in the COVID-19 tally, and we are, of course, getting ready for the briefing at the venue. It will be some time until the officials step up to the podium. For now, we are seeing the few reporters getting ready for the sessions. So South Korea now reported 63 COVID cases on Friday as it entered the Chuseok break's midpoint, the second day in a row of two-digit numbers. 53 were locally transmitted. Due to the holidays, there's expected to be less testing conducted, a trend which may have contributed to the lower figures. As increased domestic travel during the period could result in a surge of new cases, authorities remain on high alert. One additional death was reported, bringing the total to 416. And it looks like we are almost ready as our official approaches the podium, so we will take you straight to the scene. Let's take a listen.
Let us now first begin our briefing with Commissioner Chung Eun-kyung. Let us now begin our regular briefing on COVID-19 response here in South Korea for October 2nd, Friday. As of today midnight, we have 53 new local infections and 10 imported cases. The total caseload now stands at 23,952. Currently, we have 1,803 still in quarantine, and there are 107 patients in severe or critical conditions. We had one additional fatality, with the accumulated death toll now standing at 416. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now look at the updates of major domestic infections in Gyeonggi-do Province, Bucheon. We also have the Chaorim Nursing Hospital, and we have the first case of the index case being confirmed on the 23rd, and we have 3 additional cases since then, and we have a total of 4 cases so far. And in relation to a high school in Yongin City, in Gyeonggi-do Province, we have 7 additional cases being confirmed, and a total of 8 people have been confirmed to date. And we have 4 in Daeji High School and 2 in Jukjeon High School, and 2 others who are family members of the students. And in relation to Busan City's Pyeonggang Health Clinic, we have 2 additional cases, with the total now increasing to 12. And including related to a sauna in Busan, we also have 10 additional cases being confirmed, and in total we have 11 cases being confirmed to date. And yesterday we had a total of 10 imported cases. Of them, 6 have been reported on points of entry, while the other 4 have been reported while on self-quarantine. And as for the countries of origin, we have 2 from the Philippines, and majority of them were from Southeast Asia, as well as 3 from the European region. And we are enjoying our Chuseok holiday, and please note that you need to continue to safeguard the health and safety of yourself and your loved ones by enjoying your time at home. So please refrain from making outdoor activities, and also if you have to go outside, please abide by quarantine measures at all points. And if you are on the road, please use your private vehicles, and you need to also utilize the online reservations as well. And please pack your snack and water before in advance, so that you can minimize the time of stay at rest stops. And during the Chuseok holiday, we also have these screening clinic, which is operating nationwide. So if you have suspected symptoms, we advise you to get tested as soon as possible. However, we have the operation time differing during the Chuseok holiday, so please check the time of operation at the emergency healthcare website and portal websites, as well as the call center at 1339, as well as 119. In addition, during the holiday, we also have the National Foundation Day coming up tomorrow and the weekend. And we ask you to refrain from making religious activities. And please switch to non-face-to-face means. And please refrain from having small gatherings and group meals. And after the August 15th domestic rally here in the metropolitan region, we have seen the cases spreading to nationwide. So please remember what happened back then, and please refrain from going to these rallies during the weekend. And we would also like to note that starting from November, we have the influenza outbreak, and so far we will be monitoring the influenza outbreak situation. And starting from this week, we will reveal the details as well. And starting from the 21st and 26th of September, we have seen that 1.3 out of 1,000 were reported to have influenza, which is slightly decreased from last year's 3.8. And also this is slightly down from the 5.8, which is the average on year. And also we would like to continue to note that the antivirus prescription will also be monitored, and we will be having a comprehensive monitoring scheme of the influenza outbreak so that we can prevent an endemic of the COVID-19 and the influenza outbreak. And we ask the public to continue to abide by quarantine measures as well. And we are enjoying our Chuseok holiday, which is the first public national holiday after the COVID-19 outbreak. So we are asking all of the members of the public to abide by quarantine measures. And I also extend my deepest appreciation to the members of the public for your participation. And during the rest of the weekend, we also ask you to continue to abide by the quarantine measures. Please note that we need to minimize physical contact in order to flatten the curve going forward, and we still have risks of risk factors during the holiday. And please note that we have increased risks of infection through the meetings of your acquaintances. And we also had some cases in the past where people cannot wear face masks when they enjoy food or beverage together. So we are seeing some related cases being reported as well. So during the weekend and during the holiday, we ask you to minimize such gatherings. And if you have to gather, please also wear face masks at all times. Second, we also have the religious activities coming up during the weekend. Lately, we have seen a surge in the number of cases in the small group meetings as well as group meals prior to or after the religious services. And please note that if you are senior citizens, please note that you need to refrain from going to these religious services in person. And please note that all of the religious facilities need to abide by quarantine measures. And third is the events as well as group rallies. And in August 15th, we have seen that there were 227 cases of infection that have been infected by going to these rallies, and we have seen 12 clusters infections stemming out from the rally as well. And we also have senior citizens who have also lost their lives, and also we found out that people did not wear face masks, even they were outside, and also they were also situated very closely to each other, and also they had group chantings and as well, and they also shared meals. And we also are acknowledging the fact that tomorrow we will also have some group rallies, and it is also important to note that if you take and partake in these rallies And also, if you partake in these risky activities, you could also be exposed to the virus. And also, please, we ask you to switch to non-face-to-face means. And if you have to attend these rallies, please abide by quarantine measures strictly. So during the next 3 days, we ask you to also monitor your health as well and get tested if you show symptoms. And we will also stay vigilant going forward so that we can contain the virus going forward. Thank you very much.
All right, that's all from us at this hour. Do join us for more at 6 p.m. Korea time. Thank you for watching.